Hello everyone, my name is Samantha Cabral. Today I'm going to be talking about something that's been around for a while but is still a really big deal today, Medicare and Medicaid. You might have heard of them before, especially when people talk about healthcare and government programs. But not everyone knows about why or how they started. So let's go back to the 1960s. In 1965, President Lyndon B. Johnson had this great vision for what he called the Great Society. The idea was to build a better, fairer America by tackling poverty and promoting equality. And one of the biggest barriers people faced back then, and honestly still face today, was access to affordable health care. So what did Johnson do? He signed Medicare and Medicaid into law as part of the Social Security Amendments of 1965. Medicare was created to provide federal health insurance for people aged 65 and older, as well as younger people with certain disabilities. Before Medicare, about half of all seniors in the U.S. didn't have health insurance. Think about that. Just getting old meant you were almost guaranteed to face medical bills you couldn't afford. Medicaid, on the other hand, was designed as a partnership between the federal government and individual states. Its purpose? To provide health coverage for low-income individuals and families who otherwise wouldn't be able to afford care. So, while Medicare mainly focused on older Americans, Medicaid aimed to help those struggling the most financially. But why were these programs such a big deal? First of all, they provided health insurance to millions of Americans who previously had no access to it. We're talking about elderly people who were being bankrupted by medical bills, low-income families who had nowhere to run, and people with disabilities who couldn't get the care they needed. These programs were also a massive step towards fighting racial and economic inequalities. If you were poor or from a marginalized community, Medicare and Medicaid helped break down some of the barriers that kept you from getting medical care. So, why should we care about this today? Well, the impact of Medicare and Medicaid is still huge. Together, these programs provide health care to over 130 million people in the U.S. That's about 40% of the population, and it's not just the numbers. It's about the fact that these people are still protecting people who otherwise wouldn't have access to care. But it's not all perfect. Medicare and Medicaid are constantly facing challenges. Rising healthcare costs are putting a lot of pressure on the programs. And politicians are always debating how much funding they should get, who should qualify, and how the program should work. Plus, that with healthcare being such a controversial issue in America, Medicare and Medicaid are often at the center of debates about what kind of healthcare systems this country should have. What's important to remember is that these programs were created to protect the most vulnerable people in our society, that were built on the idea that healthcare should be accessible to everyone, regardless of their age, income, or health status. And even though Medicare and Medicaid have been around for 60 years, their purpose and relevance haven't gone away. They're still shaping our conversations about healthcare inequality today. Thank you for listening to my brainrot lesson about Medicare and Medicaid in LBJs Great Society.